On today's episode, I'm chatting with Dr. Parviz Kavoussi. We're talking about the pitfalls of anabolic steroid use and the impacts of low testosterone on the veteran population. He also emphasizes the importance of advocating for your own health and talking to your doctor if you feel that you have low testosterone and want to get it treated. Stay tuned for another important episode related to your health, and make sure to hit subscribe and like if you're enjoying this content. And don't forget, stay tuned to a broader series on hormonal health for veterans, all thanks to our sponsor, Natesto. I'd like to thank today's sponsor, Natesto. Natesto is an FDA-approved testosterone replacement therapy. For those of you that are suffering from low testosterone and want to know more, head to natesto.com for more information. Parviz, thanks so much for sitting down on the podcast. You're a urologist and you are a prolific paper writer. You've got over 80 published papers, which is amazing. From what I understand, that's well above the mean for publications. And so congratulations on that. And it's an honor to have you here because you've got an perspective on male health, and the point of having these conversations is to improve the awareness, especially around our hormones, because a lot of us in the military community just are not tracking. We are not aware that it's an issue because our doctor doesn't tell us that it's an issue, and typically we're rule followers. So if somebody doesn't say, hey, troop, go sort this out, we're not going to go out and try and sort this out. So the point of today's conversation is really to look at a few things, namely the pitfalls of doing anabolic steroids. So for the gym guys, being on gear, because that's pervasive in our culture, but also the detriment of having too low testosterone and all the little nuances that come with it. So welcome to the podcast. Appreciate you being here. And how are you doing today?
Thank you. Doing great. Thank you for having me. And I just want to echo a little bit of the sentiment that you said, especially for our service members and our veterans. I spent a lot of my time in a training in the VA as well. And men overall don't tend to advocate for our health, and men that are military or ex-military, we see that in less. Like you said, you're built in a certain way as rule followers, and you're going to go the direction that an expert is going to lead you. But I think there is a role for advocating for yourself and for your own health. And so I think asking those questions: are my symptoms consistent with low testosterone? Understanding that although we don't have perfect data on this, anecdotally, we see a lot of men that have been deployed come back then having low testosterone. Whether that's exposure or what the scenario is a little bit difficult to know, but it's very common. And so that's a significant impact on the quality of life, especially from the mental health standpoint, where so many men that have been deployed are having challenges and struggles, rightfully so, from the experiences they've had, whether that's PTSD, whether it's depression, whether it's anxiety. If that testosterone is low, it's going to make all that amplified. And when we can treat that, it doesn't fix all that, but it makes it better. And so we can get improvements, and every piece of the puzzle matters here.
Yeah, absolutely. I'm curious, in terms of exposure to toxic substances, mild traumatic brain injury, all the things that are typical of a deployed soldier. What is it that is the most detrimental? Is there something that we should absolutely be more aware of if we've been exposed to, or is that almost impossible to kind of pinpoint? Because from my experience, right, toxic exposure, 100% burn pits, heavy metal exposure, all that stuff. But then there's the mild traumatic brain injury. Is there one of these things that may cause some hormonal disruption more than others, or is it really multifactorial based on what you've seen?
I think it is multifactorial, and I don't know if that's been quantified, but I think there are multiple factors, like you said, that are going to be contributory. And we know there's toxic exposures. We know there's chemical exposure. I talk to the servicemen who they run their Humvee through the X-ray 4 times a day, and you're getting, that's all radiation exposure. And then the traumatic brain injury and the effect on the hypothalamus, where all this hormonal regulation starts. So it is strongly multifactorial, and I'm not sure there's a way to tease out how much of it is based on what, but all this combined can be really detrimental for that hormonal axis.
Right. Now, I'm not too sure if there has been any studies yet conducted that shows quantifiably that veterans of the global war on terror have lower testosterone levels. But just anecdotally,
Yeah.
I can say that from my friends and those that I know that have gotten tested, it is definitely lower, and that's over and above the general trend in Western society that's seeing just a general drawdown and a lowering of overall testosterone levels. So, in terms of just the general population, from what you see, is that something that you're noticing too? Just generally, men are having lower total testosterone levels, and I guess to suss that out a little bit more, is it a factor of, or is it because men are starting to be more aware and getting tested more, so we're getting better data that's showing it's lower, or do you really think that there's an actual general decline in overall men's total
I
testosterone?
think it's both. And just to go back a second, certainly anecdotally, I see that too, that our service members are military personnel. These are typically guys that are younger a lot of the time. If they're still in service, they're coming with symptoms. We're seeing a lot of younger men. And again, they're usually the guys that have been deployed 2 or 3 times that we
Mm-hmm.
find with a lower level all of a sudden, maybe less expectantly than we would in the general population at that age. We know that all of us start to lose testosterone typically around the age of 30 and about 2% a year beyond that. So I think you're exactly right with what you say is we are increasing screening. There are more people that are being evaluated. So the more you look for pathology, the more we're going to find it. And so, yes, we are in the place where we should be that, well, actually not where we should be yet. We should be doing better, but where more and more men are being tested and being evaluated and being treated. Still, the last statistic I saw, I think it was about 3 or 4 years ago, showed that maybe 5 to 7% of men that have been diagnosed with low testosterone in the United States are actually getting treatment for it. It's actually exceptionally low, despite the fact that
Whoa.
we think that we're giving testosterone to everybody. And so most of us would argue it's actually being undertreated and underserved. But yeah, so as far as general population, it's very likely that we're looking for more, but it's also that there are likely environmental exposures that are worsening our testicular function. So, I mean, if you look at the anatomy, how we're built, there's not an awful lot between the testicles and the outside wall to protect them. There are very few organs that are that exposed, right? And
Yeah.
so
Right.
environmental factors matter. And so we extrapolate a lot of data from the fertility data, looking at the effect on cellular function, but we're all walking around with cell phones in our front pocket, centimeters away from the testicles. That's high
Good point.
frequency electromagnetic radiation. We sit around with laptops on our laps until our thighs burn. That's elevated temperatures that the testicles are supposed to live at a lower temperature than the core body.
Yeah, but I got to get this report done.
Exactly.
I
Right?
got to get it
But
done.
put on a hard
My
surface.
nuts can
That's
go. Yeah.
good. But all the stuff. There's phthalates and plastics all around us. I can find you a study pretty much on anything environmentally, and they may be incremental effects, but that cumulative effect on top of increased screening and increased awareness, I think, is why we're seeing so many more men being diagnosed.
Wow, that's that. Only five to seven
That was a
percent
report
are
that came
being
out about
treated.
3 years ago, and it was a survey that was done, and it was really astounding that it's really being underserved and undertreated. Now, hopefully, every year we're doing better. I mean, there are millions of
Hmm.
men being treated every year now, but it's still, like you said, I think when we were chatting, there still tends to be a fair amount of resistance by a lot of healthcare providers to treat low testosterone or even evaluate it. So I've got patients
Hmm.
week in, week out that say I keep asking my provider to say, "Can you check my level?" Well, don't worry about it. We'll check it next time. Or they check it and it's low. And they go, "Well, we'll just check another one. We'll check another one. And we'll check another one," and they just kind of kick the can. And so
Hmm.
there has been a hesitation to treat, and we need to be more proactive in cases that are appropriate to treat. Now, not everybody on the planet needs testosterone replacement, right, or supplementation.
Right.
It's treating the appropriate patients, just like any other hormonal deficiency. And again, I always kind of use my analogy as the thyroid. It's another gland in the body. It's not making a hormone. If that's the case, we treat it. And we treat it to physiologic normal levels, not super high, super therapeutic levels where there could be more risk, and we don't want them low where there's risk. We want them in that sweet spot. That's physiology.
Hmm. So, I mean, from my perspective, I see the resistance to treatment as, well, they don't, by they, I mean, frontline, general practitioner, doctor, right, isn't well versed enough to know that it's beneficial enough, and may have some underlying biases to not prescribe it because they're just not well versed in the treatment. That's one thing that I think might be happening. But the other thing that I'm concerned with is that prescribing testosterone, like, let's be honest, it doesn't cost very much. It's very cheap. So is that something that may be influencing doctors? Because I know that a lot of doctors, right, like depending on what drug they're prescribing, there is a financial incentive. So do you think there's some issue there with the fact that it's just not financially viable for a lot of these
So
doctors to just even prescribe it?
that one's a little tougher to know on an individual case basis, but my inclination would be to hope and say no, because the fact that
Right.
writing prescriptions is not where we make our money, right? It's
Mm-hmm.
it's what the visits, the consultations, procedures. That's where the income comes from for physicians and providers. So my hope is that that's not a true incentivizer. Now, if somebody is compounding drugs in a pharmacy in their own office, well, that might be a little bit of a skewer, but usually
Mm-hmm.
that's not going to be the big driver. I think one is a lack of education in certain fields, but also with the disclaimer that the generalists have a much harder job than I do. Right? They have to know at least a bit about everything. Where I get to just live my lane and I know everything I have to know about this one or two disease processes. So the truth is, I've got a much easier job than they do, because they have to make sure they're being safe and being effective
Mm-hmm.
in a very wide breadth of medicine that is a very difficult job to do, to be honest. So there is some understanding that that's why they send a lot of their patients to specialists when it comes to testosterone deficiency. Now, the fact is, there are too many men with testosterone deficiency for specialists to take care of. And ultimately, my bet is it is going to become like the thyroid. Like in the old days, there was a thyroid deficiency, they all went to endocrinologists. Now, pretty much every primary care doctor in the sun treats hypothyroidism, right? My guess is that's probably where testosterone deficiency is going to go as we get more education. And I think it is motivating, and it makes me optimistic to see that there is a great deal of interest in it from a lot of primary care doctors. I gave a talk in Houston a few years back at a big primary care meeting called Primed. It was the last session of the meeting. That's usually when people are checking out of their hotels and heading home. And it was standing room only, about 300 people in this place trying to learn about testosterone deficiency, and they're all primary care. So I think the more they
Hmm.
learn, the more they educate, and the more we can relay that testosterone deficiency is a health issue. I mean, if you're truly below cutoffs of deficient, we see bone density loss, osteoporosis, fracture rates go up, more difficulty regulating blood sugars. There is data indicating better survivorship. We tend to live longer with a normal testosterone level than a low one, and it's highly correlative with metabolic syndrome. We see, not that this is characterizing every man with low testosterone, but we see an association with diabetes. 33 to 50% of diabetics have low testosterone. There are certainly associations with obesity, with hypertension, with dyslipidemia, cholesterol issues, all the things that we know in this metabolic challenges that a lot of men have. There is a very strong association with testosterone deficiency. So once we can educate that this is another part of a global health evaluation and treatment, and that we do see benefits in bone density and blood sugar regulation, our diabetic patients do a better job controlling their sugars when their testosterone is normalized. They're going to burn fat better, and we're going to increase muscle mass. And now we know obesity is really one of the bigger risk factors for all the pathologies we see. Now that there's not as much smoking in the U.S. anymore, it's thought that obesity is the number one cause for cancer. Obviously, we know
Mm.
that's impacting coronary disease, all these other factors that we see. So it's really, really hard to keep a good muscle to fat ratio when testosterone is deficient. That's a building block the body needs to help do that. So it's integrated in all the health issues that we think of, and the general practitioners are going to become more and more educated and aware of that. My hope is that at some point they're going to really take the reins, because there's too many of them for me and my colleagues in our subspecialty to take care of all these men. They need primary care
Right.
doctors to be the front line.
So why is it then testosterone is so important for all the things you just mentioned, like metabolic disease? I've covered with Dr. Ovadia, where, like obesity, high triglycerides, high blood pressure, these are all, insulin resistance. These are all factors that lead to metabolic syndrome. So is it almost safe to say that folks that are experiencing metabolic syndrome should get their testosterone levels checked, obviously the men, because this is just like a big flashing alarm bell that you've got something wrong within your hormonal framework, so your endocrine system. If you could expand on that, I'm just curious to know. I think folks would like to know too, like how does testosterone drive all these things? And if you have low testosterone, how does it impact you on all those factors?
Yeah.
Fellas, bring it in, nice and tight. Bring it in, nice and tight. We need to talk about it. All right, seriously, we need to talk about something that most of us don't want to talk about. That's why I put on my nice blue dress shirt to bring a bit of seriousness to an often hilarious topic. But your sexual health is no joke. Seriously, though, sexual health needs a lot more attention than it's been given. Let me go over a few things here. Research has shown that regular sex, what's 1 to 2 times per week, can reduce the risk of cardiovascular mortality by 50%. Bring that one to your wife right now. Lower the risk of prostate cancer by 33% and reinvigorate your mind and body. The problem is 40% of men in their 40s, 50% of men in their 50s, and 60% of men in their 60s experience some form of erectile dysfunction. This is even worse in the veteran community. On top of all this, erectile dysfunction is correlated with a future cardiovascular event and is an early warning sign of a future issue. This is why Dr. Elliott, board certified urologist and friend of the podcast, has created this one of a kind, first in its category, revolutionary device called the Firm Tech Ring. This high-speed tech for your dick will give you real-time data and allow you to see how many nocturnal erections you get every night, which can be a great bit of data that you can bring to your doctor for a future conversation. Not only that, this data could literally save your life. You know, I'm all about improving the health and lives of the veteran community. And that's why I've paired up with Dr. Elliott Justin to provide you with a 10% discount if you head to the link that's here in the description to get yourself your first Firm Tech Ring if you use the code DMORO at checkout. So head to the link in the description and start tracking so that you can start banging. All right, brother. So go do what you got to do and be one of the first to bring a whole new meaning to being hard to kill. I want to be able to save you almost $4,000 per year. If you haven't got yourself a copy of The Nimble Warrior, this is my first book, and it is all based on what I've done in order to get myself out of the pain cave. Let me explain. Over 60% of Canadian Armed Forces veterans are experiencing chronic pain. Of all the medical releases, about 42% are musculoskeletal injuries. If we boil that down, a lot of us are suffering from back, knee, and hip injuries. What that means is we're experiencing high levels of pain, which reduce your quality of life. If you want to change that, I recommend getting a copy of my book, The Nimble Warrior, right here. You're going to be able to find a copy on Amazon, and you're going to be able to start doing the protocol that I use to help myself get out of the pain cave when I hurt my back. So head over to Amazon right now. Description is in the bio. Link is in the bio, and you're going to be able to get your own copy in time for the Christmas season so that you can start moving and grooving and feeling a lot better about yourself. So head to the link, head to the description, and get yourself a copy of The Nimble Warrior. Peace.
And so I think that's a really, really good question about how that impacts the metabolic effects that we see. Should we screen every man with metabolic syndrome? It probably depends on who you ask. If you ask me or those of us that are specialists in this, I think we would lean the answer towards yes. Why would we want to miss that in them? But if we go to guidelines, which is what we're meant to base our practice patterns on, based on evidence-based medicine, if we turn to the endocrine society guidelines, the recommendation is actually not to test testosterone levels in men that are asymptomatic, that don't have symptoms. Now, my personal view is that if a patient has a really low testosterone and it's going to impact bone density a bad way, blood sugar regulation bad way, metabolic syndrome, and survivorship, whether he has symptoms or not, I would want to treat that man. So again, not all of our practice patterns perfectly fit guideline statements, but we try to stay in our lane a little bit to make sure that we're not just all over the place in practice patterns as well. In my opinion, if I've got a patient that I'm suspicious of because of other health risks, I would test them. Now, how that impacts things, a lot of it has to do with body composition. I think the more and more we learn, and again, there's metabolic regulation that testosterone is important for, but the more and more we learn is that obesity is this major epidemic, not just in the United States but worldwide. Childhood obesity now. And what does obesity do from a testosterone standpoint? It causes a vicious cycle. So when there's obesity, fat cells convert testosterone into a form of estrogen, estradiol. So the more fat we
Mm-hmm.
put on, the more testosterone we convert to estrogen. Your estrogen goes up, your testosterone goes down, which is pretty much bad for everything. And then on top of that, where do men tend to put fat on? The lower abdomen, upper pelvis, and we're actually increasing testicular temperatures in that area. And again, if you look anatomically, men are basically built with the testicles outside of the body down the scrotum because they function better at a 2 degrees centigrade cooler temperature than the core body temperature. And so when we're increasing fat content down there, that's going to increase testicular temperatures. So we have multiple mechanisms by which obesity is impacting our cellular function, and then it's a vicious
Oh wow.
cycle. Testosterone drops, it's harder to burn fat. We put more fat on. Estrogen rises, that makes us put more fat on. So we have to break this cycle. We have to get testosterone regulated. We have to get estrogen optimized, allow that body composition to improve. There are even some men that may have borderline testosterone levels where we can make these lifestyle changes, and they're able to regulate their testosterone optimally. Now, the truth is, that's really difficult just because of the way lifestyles are these days. Diets, how we live, number one, but number two, because it is really hard to burn fat with a low testosterone. So sometimes we'll use treatments, sometimes rather than replacement, we'll use cellular stimulating treatments, Clomid, HCG, other ways like the nasal gel and the Natesto that are not as suppressive to the system and will allow that man to be treated to normalized levels. And that helps with the improvement of body composition. And then we may stop that treatment and see now that we burn fat and we allowed the body to maintain muscle, which of course they've got to do the work. They've got to do the diet and the exercise. They can't sit on the couch and just take, their testosterone treatment,
Oh,
right? You know that. So,
oh, so you mean I can't just take testosterone therapy and just sit down and do
right.
podcasts all day?
But the
Shit.
motivation's not there either, though, right? I mean, this has been shown in study after study that when testosterone is deficient, that I should go to the gym, but I just can't get off my couch. That is a really interesting factor that we see change when testosterone is normalized, and men are getting
Mm.
more motivated to get into the gym and work out and do those things. So we're able to reverse that vicious cycle, and sometimes we can just stop treatments, and if we get enough optimization of body content, we might even be able to keep that man off treatment.
Okay, that was going to be my next question because from what I understood, as soon as you start, that's it. You're on that slow train for the rest of your life with
So that's
TRT. But
kind of
there is a way to not potentially be always treating yourself with TRT if you're able to get, let's say, body fat down, motivation goes up. Now you no longer have that vicious feedback loop of being obese or having too much body fat, producing too much estradiol, which demotivates you and stops you from burning body fat, which stops you from having a higher testosterone. So if I understood that correctly, there is a way forward that doesn't require constant
so
supplementation.
first and foremost, we would always encourage lifestyle modification as a first step rather than medication, right? So
Right, right,
diet,
right.
exercise. If a patient is motivated, that person is willing to do that. But again, it's really hard to do that when your testosterone is low. You just that something cerebrally is not that motivation center is not doing what it's supposed to with a testosterone deficiency. So that's why I mentioned kind of these off-label treatments rather than direct testosterone replacement, like Clomid and HCG, which are ways of stimulating cells to make testosterone. Where when we stop them and when we use them, we're not suppressing the testicle cells. That's why we think of testosterone as long term, is because we're going to suppress that system. And then that could commit men to long term treatment if they're on it for long periods. Now, if you're on testosterone for 3 months, 6 months, a year, and I take you off it, it's very likely you're going to bounce back to where you would be on your naturally declining curve. If you're on it for years and years, then those cells may not wake up and start working as well. But that's another great place where I think, I've done, as you know, a lot of research on the intranasal gel and the Natesto that
Mm-hmm.
Viserys has. And I think that's a really nice use for that because that is one that is very minimally suppressive. The signaling center under the brain that sends signals testicles to work, those signals on any other form of testosterone replacement bottom out to zero. Testicles quit working. We take over function with the drug. With the nasal gel, because it's short acting and it's pulsatile, trying to mimic our physiology, it allows for the overwhelming majority, not 100%, but nearly, men to continue that pulsatile signaling of hormones to the testicles to keep them working. So we see that not only can most men maintain spermatogenesis and fertility, but they can maintain their own testosterone production. So I think of that drug like where other testosterone replacements, we're giving it to them, we're stopping their system and taking over that function. This drug is allowing their system to work and giving them a little extra on top of it. And then we talk about medicines like Clomid or HCG that are just pushing the whole system to work harder, but may not get as strong of a symptomatic response as we do in testosterone replacement. So if our goal is in a guy who maybe has low to borderline low levels, not extremely low levels, and has some body composition room to improve, there's some room to burn fat and put on muscle, he may be a great candidate for one of these treatments temporarily to see can we improve body composition, stop it, reassess, and see now have we normalized or no a cellular function such that we're going to be treating long term.
That makes a lot of sense. I think I'm the perfect candidate right now.
Well, you're elite, right? I mean, you got good build, you're elite, so I think that's kind of a good candidate for this. Absolutely.
Yeah, I mean, we were discussing before we started hitting record. This has been something I've been tracking for the last few years, and I can't get my total testosterone past 300. I'm just kind of stuck, and I've noticed harder to burn body fat. Yet I'm doing all the things that I preach. I train regularly. I watch what I eat. I sleep well. I'm doing all the things, but it's always just this stubborn last little bit that I can't get rid of. My energy levels are never quite high, irritability. And so it seems like everything's dovetailing to, well, maybe I just can't get my testosterone past that level because I'm stuck there. And something like this may be a good solution for the short term, at least, to see if it actually gets me over that hump where, hey, yeah, I burn like an extra 2-3% body fat. I feel great. And things are kind of back on track like I was in my 20s. So you're referencing one of the papers that you authored when we were talking about Clomid. It also mentioned that there's a bump in libido. Is that because if you are doing other forms of testosterone replacement, is it common that libido goes down? Because my understanding is if you're on testosterone therapy, like your libido goes through the roof. Is that just a misconception of testosterone therapy?
Again, I think our goal is always to treat the physiology. So when I'm treating a patient for testosterone deficiency, the truth is we never know where his baseline was before he was low a year before, 10 years ago. So we have ranges where we know that men should be living out with a normalized testosterone with optimal symptom response and health response. So that's kind of where we target treatment to. If we go super therapeutic too high, that's when libido really goes to the roof, and that's probably too much. But where we want it is where it should be naturally, physiologically. So when it's low, we're going to optimize it by getting testosterone normalized, and some of that is estrogen effect. So we do need some estrogen, right? It's not that we want none. If estrogen is too low, we actually see a lower libido, and there is some hypothesis that may be part of why we see low libido and low testosterone. When your testosterone is really low, there's not much around to convert any to estrogen, and we need some for libido and bone density and things like that as well. So the paper that you're referring to is the one that we took men from Clomid, a drug that stimulates the cells, and it's used off-label. It's not FDA approved for men. It's FDA approved for women. Then we've been using it for decades and decades with tons of studies and data showing safety and efficacy of getting testosterone up in a testicular function preserving manner. So we primarily reserve that for our guys that want to maintain fertility. Traditionally, that's what we would use because it doesn't suppress their sperm production. But if we take all our guys on Clomid and at some point switch them to testosterone replacement, which in our study we looked at Natesto because we're looking at its capability to maintain sperm production in most men are going to get a better libido on testosterone replacement than they do a drug like Clomid, significantly. In our study, 92% of men reported better libido on Natesto, the nasal gel, than they did on Clomid. And testosterone replacement tends to do a better job symptomatically across the board than things like Clomid, drugs like Clomid do. So what I kind of tell patients is if you're down here symptomatically, on Clomid I can probably get you about here. So when the day comes where it's appropriate from a fertility standpoint or what have you to get on testosterone replacement, then your symptomatic response will go up here. And when you were talking about the symptoms that you're experiencing, I think we do have to be a little bit careful, right? Because when we talk about symptoms from low testosterone, they're kind of these vague generalized symptoms. And low testosterone is not the only thing that can cause those. Overwork, lack of sleep, too much stress, other biochemical factors can cause those. But when we see it clearly low testosterone, being deficient under 300 every time, none of us would hesitate to treat that in a second, that have an expertise in this. Then we reassess to see what symptomatic response did you get over time. And usually, does it make everything perfect? Usually not. Usually makes things an awful lot better. And so then what's left of symptomatology, okay, now when we've got an optimal testosterone to estrogen ratio, and there are still some symptoms left potentially, now we know that testosterone is no longer the cause of those. So now do we look for things like vitamin deficiencies, obstructive sleep apnea, thyroid, cortisol, their adrenal hormones, lifestyle modifications that can be continued to be adapted. So it's never quite as simple as this is the one thing that's going to be the 100% fix, but it's a really important part of that puzzle.
Yeah, that makes a lot of sense. I mean, there's no such thing as a silver bullet.
Correct.
Is basically when we're dealing with the human body, there's so many factors that contribute to certain symptoms. It's really taking your health, and I always preach this as much as possible. You got to be responsible for your own shit. Like, you need to be able to identify, this isn't going well, what do I need to do? And then have a discussion rather than a one-way conversation with your doctor, who's, you know, going to recommend the best course of action. But you can easily have the conversation based off of research and based off of what you want to do with your doctor. And he should, or she should, be able to have that conversation with you and collaborate on next steps. In terms of the effects of low testosterone, you wrote an article, which is called Borderline Low T Might Affect Your Health. Just a quote from it that is really, I think, relevant to the veteran population is that half of men referred for borderline testosterone levels have depression. That, to me, is a really big alarm bell, because anecdotally, you know, I've suffered from depression. A lot of my friends have suffered from depression, you know, as veterans. And again, the testosterone conversation is never part of the conversation. Could you expand a little bit more on like what you're seeing and like how this could potentially be another tool to help combat the mental health crisis that's going on, especially for men that we're seeing in the West, especially?
Absolutely. So first, I just want to re-add, you know, again, men don't tend to advocate for their health very well, and certainly military personnel, I think that's even accentuated in, because you know you're built tough. You're built. This is your task. This is your mission. And if you're hungry, if you're tired, you do your mission, and you take care of business first. And so I think that translates to civilian life when men are out, or even when they're home off deployment, where they're just going to suffer through things because they think this is the way it is, and this is I can get through it. I've gotten through worse. But this is a really important part of quality of life, and it's an important part of health. And so again, we see a lot of our veterans and our service members that are not feeling well, and a lot of that has to do with mental health. And the fact is that men that have been through deployments, I can't think of a more stressful mental health situation than having patients that have been through deployments. And so the experiences there are not comparable to anything else that any of us experience, is the truth. And so there's no way to go through that and come back without some impact on mental health, depending on the severity of those experiences. So I am happy to see that in my region, at least in Austin, I am seeing more psychiatrists, more primary care doctors that are starting to pick up on it. There's a couple psychiatrists in here in town. Every patient that walks in their door for depression and anxiety, they check testosterone on them. And again, this is the exception. It's not the rule by any means.
Right.
But it's showing us these trends are going in the right directions. There are study after study showing low testosterone impacts depression, anxiety, shorter fuses, more reactivity, all these things that we see emotional responses that afterwards the guy's like, man, I just yelled at my kid for the 5th time today, and I never did that before. And, it's not, they don't feel like themselves. I don't know why I can't control that response, or the severity of depression or anxiety. And again, I'm always careful. I don't want to make testosterone the fix-all for everything, but it's an important piece of that puzzle. And I've got patients that are backing off on their SSRIs, their depression medicines, because we get their testosterone optimized. And again, there are other biochemical reasons why a lot of men have depression, anxiety, other mental health challenges, But when there's a low testosterone, it's always going to be impactful in a negative manner. So at least you get that
Hmm.
variable out of the equation, see how much gain we can get, and that can really improve the quality of life and mental health. And I think this is really important because when we talk about health, hormonal health, what do we always think about? We think of obesity, we think of the heart, we think of bone density, we think of blood sugar, the metabolic things we talked about. But you can't exclude this. This is a really important part of our health, and it interconnects with everything else. That's where it all starts. And so mental health is crucial to optimize in all of our patients, certainly our male patients, certainly our military patients. And those are some of the people that have gone through the most stressful times that most of us can't fathom. And so
Hmm.
you have to be your own advocate. The fact is that most of the time, if you go to your primary care doc and you say, I'm feeling depressed or I'm having these feelings, they're not going to jump and say, get testosterone. But if you ask for it and say, I've heard that that can be associated, well, that's a reason for them to check it, and whether they're going to treat you or get you in the hands to treat you, it can be very useful.
Hmm. Yeah. And I guess I don't know if it's a catch 22, but if your testosterone levels are low, like we already discussed, the testosterone is the get up and go
Yeah.
hormone. That's the motivator, right? That's the positive form of aggression. Like, hey, I'm going to get up and like crush today. And I have a lot of days where it's just I've got a lot of things on the go, and I'm like, no, today for whatever reason is not the day, and I can't pinpoint why, because it's not like I overtrained, it's not like I didn't eat well, it's not like I didn't sleep well, and those are the things that kind of make me realize like maybe this is the issue. But in terms of mental health, especially for guys that might be struggling, oftentimes, and this is from my own experience, I don't even want to go talk to my therapist. I'm just like, man, I don't want to check in. And it's because I don't have like maybe it isn't low testosterone that day, but it certainly feels like there's a force that's holding me back. So imagine what could happen if, individuals are now just, they have that little bit more motivation, right? Because I think you have to do both. You
Yeah.
can't just dissociate the body from the mind. If you're working on your mind and you're doing the work with your therapist or whoever it may be, I think that the component that we often overlook is like, well, your body is the vessel in which your mind moves through space. And if it's not doing well, I can't see how you get any benefit from therapy. So this alone seems to be like one of the missing pieces from the conversation. And I'm hoping that, folks kind of latch on to that idea that it's not just treating the psychological that's going to help you if you got psychological issues. There's the holistic approach to it, and being aware of your testosterone levels may be one of the main components to getting yourself healthier and fitter in the future.
I couldn't agree more. And I think it's something I see week in, week out.
Yeah. And it's good that we're doing these type of conversations. And that's really the point of the podcast, is to really just make folks aware. Just ping the freaking like brain center here to say like, hey, go get this checked out. A blood test is
Simple.
no sweat. I did one literally yesterday. It took 5 minutes, like in, out, done. And you could have a whole like wealth of information that can really benefit you long term and potentially solve an issue that you could be having. I wanted to just harp on just one last thing. The issue with low testosterone, right? Low testosterone, like long term, we touched on it briefly, but I really want to hammer this point home. If you have chronically low testosterone for years and years and years, is there an increased risk of like cardiovascular disease and all the kind of nasty things that can come about from having low testosterone?
So that is a question that I lean towards the answer of likely yes, but if we go database, it's very impossible to answer for certain right now because there's mixed
Okay.
data. We do have studies. There's one published by a guy named Randy Urban, endocrinologist out of UT Medical Branch in Galveston about 4 summers ago, that showed cardiovascular specific survivorship improvement. Men live longer, specifically from a cardiac standpoint, when they were treated to normalize testosterone levels than when they were low. Now, the fact is, if we look, we can find data both ways, right? We can find
Mm-hmm.
3 or 4 studies that most of us will argue are done with exceptionally poor methodology that showed significant harm. But I'll also tell you again, those studies when you look at them even superficially, it's very clear they're methodologic flaws. And if it's poor methods, it's garbage in, garbage out, right? There are not perfect studies for cardiovascular outcomes. The Traverse trial just completed last year, which was the largest randomized controlled prospective trial, which we consider high level evidence, level one evidence, meaning the results should be very reliable. And it had thousands of men over a 2 year period treated with testosterone deficiency. And they looked at cardiovascular events and they saw no increase in cardiovascular events, bad effects on the heart over that 2 year period in men treated versus placebo versus quote unquote the sugar pill, but that form of testosterone did not show any adverse effect. Now, there's lots of data, decades worth, mainly in the cardiovascular literature, showing safety. And there's some studies, again, showing cardiovascular improvement. Now, does that all make sense to me that there should be improvement? Of course it makes sense to me because we're getting better blood sugar regulation. You're improving muscle mass. You're burning fat mass. You're improving exercise motivation and tolerance. All that should mean better cardiovascular outcomes. And that's actually what I believe, but that's extrapolation of data. We can't say because these other factors we know we're making better that for sure makes cardiovascular outcomes better. We have to prove that scientifically every time. So the problem is that we can find mixed data. The data that shows harm, most of us would argue, is done with pretty poor methodology and that we don't put a lot of stock into. There are moderate studies that show safety, that show improvement in outcomes. And then we've got a couple of really well done studies showing no harm. And so I think that's where we are data wise. But knowing what we know about physiology, metabolism, do most of us believe that if you live with a chronically low testosterone long term, that's bad for your bone density, bad for your muscle composition, going to put fat on, worsen your blood sugar regulation, and decrease your willingness and interest in exercise. That's bad for your heart. Most of us believe that.
Right. Yeah. Okay. That's a great summary. I think that the fact that if it's not at adequate concentrations, it's just your ability to get up and go is going to be affected. And just that alone has serious knock-on effects long-term because you're not going to be physically active. You're not going to want to eat well. All those motivators just kind of get washed out, and then your health starts to continually spiral downhill. And I've been down that road. I call it the Dave Morrow downward spiral of shit. I got a name for it.
I call it the ump factor, but either or, right? I mean,
it's like a one day, 2 days, now third day, things are starting to fall off the rails. My sleep is off. I'm starting to eat chips. Like as soon as I start eating chips, my wife knows, Dave, what's going on here? I'm like, yeah, you're right. I'm a little bit stressed out. Things aren't going so well. She's like, yeah. So if you can identify it and then nip it in the bud before it gets any worse than 3 days, then that's typically like my standard to get out of the funk, out of the spiral of shit. So I guess to summarize, this is what I'm hearing, but there's not enough men taking care of their hormonal health, but their health in general. Only 5 to 7% are even being treated for low testosterone. So ultimately, to get the action step out of this conversation is, if you're feeling kind of down, if you don't really have the drive, you're having a little bit of hard time getting rid of body fat, you don't really feel like even going out for a walk, it might be in your best interest to go get a blood test and have the conversation with your doctor if your testosterone levels are low, to maybe take the next steps and consider replacing it for a window of time to see if it actually improves your health outcomes, meaning you feel a little bit better, you feel like getting after it a little bit more, and you might be losing a little bit of body fat. Is that a fair
I think
summary?
That's a great summary. I mean, I would just say again, listen to your body, right? I mean, if you are the things that we see men come in and complain of when we find their testosterone levels low, a lot of you mentioned the low energy, fatiguing faster, lower sex drive, more difficulty with erections, more difficulty putting on muscle and burning fat. These guys are coming in like, I'm in the gym all day and I'm not getting the returns, I'm not getting the gains I expect. More difficulty with sleep, focus, concentration, moodiness, irritability, hot flashes, night sweats. These are the very common symptomatology that men will come in complaining of. At the very least, check a level. Like you said, it's a simple blood test. It needs to be in the morning. Often we recommend 7 to 10, maybe 7 to 11 in the morning to check peaks. And then you've got your answer. If it's normal, great. That's out of the equation. Now we can look for what else is going on. If it's low, let's rekey the test. We always check a second one. We take some adjunct testing, other hormones that impact that axis. We check the safety things like the red blood cell count, the prostate cancer screening test, and let's get you on treatment and improve your quality of life and your health.
Awesome. Before we wrap up here, is there any last words of wisdom, and also where can folks read your articles and get a better picture of what you're up to?
So one, if you, our website is austinfertility.com is one of them. austinmenshealth.com is another. And if you go to the blogs, we basically blog on every article that we publish. So you're able to track and find those and see kind of the summary that's not quite as laborious and scientific and boring. So that's a quick, easy way to kind of get some of the information. But I think the take home is listen to your body. If you don't feel right, there's probably something that is not right. And whether that's testosterone or not can be very easily identified with a simple blood test. And again, getting treatment. I mean, this is what we do all day long. Massively improves the quality of life of most men. So don't ignore it.
That's awesome. That's awesome. And I'm glad you summarized things, because there's a lot of crayon eaters and cavemen like myself from the infantry that like summarized articles that can bring it down to a level. So that's
if I had to speak your language, it would be great. My best friend in the world is a Marine, and when we talk, we speak different languages than each other. But I have the utmost respect for y'all's work and what y'all do, and God bless you for doing it. Thank you for keeping us.
Right on.
Thank y'all for keeping us safe.
Right on. Thanks so much. And really appreciate your insights. The community definitely benefits from hearing from experts like yourself. And folks, if you want to learn more, you're definitely going to want to check out the links that are going to be here in the description. Get educated, get tracking that your testosterone levels are an important aspect of your health, and stay tuned for more episodes on this important topic. But don't forget, train hard, fight easy. I'll see you in the next one. Peace.